Hi, my name is Christian French, and this is the Landing Air Scoring System Test, or the LESS test. So, the LESS test is used to identify dysfunctions in jumping and landing. It's based off 9 different jump and landing concepts with 13 yes or no questions, and it's kind of like golf. You want a lower score. Lower score is better, usually indicative of less of an injury risk. Higher score, more of an injury risk, typically. So the procedure is pretty simple. All you're going to need is a 12-inch box and a camera. Everyone has a phone that usually has a camera, so it's nice and simple. So 12-inch box, you're going to put cameras in the front and the side, about 10 feet away. You can do this on separate trials. Ideally have them both at the same time. So just 10 feet away, camera right in front and camera right to the side. So I'm just going to jump forward off the box and immediately jump right upon landing. They're going to jump about half of their height forward ideally, and they're going to repeat that 3 times. So jump off the box, jump immediately upon landing, and they're going to repeat that 3 times, and that's the whole test. So how it actually looks, got a couple of videos here. So just jumping off, as soon as I hit the ground, I'm trying to jump as high as I can, and then you'll use these videos to kind of analyze, because obviously it's tougher to see this happening in real time. So that's the front view there. Show a few reps from the side. Yeah, and then you can kind of dissect the video from there, look at different errors from the questions that are given. And here's a little bit of a slow-mo view. So could be a little bit helpful to have it in slow motion, break it down, even take like screenshots. It's tough to see this stuff with the naked eye at first. There's the front view. And then we'll go from the side view here. Again, could probably jump out a little bit further. Ideally, they're jumping out about half of their height forward before they do that second jump. And then when we talk about scoring, obviously you can read these. There's 13 yes or no questions. They're usually on a 0 to 1 scale, with no being a 0, which is obviously better, and then yes being a 1. Only a few of them have a 2, like right at the end with the overall impression. Excellent is 0, average is 1, poor is 2. So obviously you want a lower score. Knee valgus in there, trunk flexion at angle. So it's very in depth, which is why it's important to record it and go back through the footage, because it's really hard to see all this stuff at once in real time. Some of the common errors you're going to see: knee valgus, which is when the knee doesn't get over the midfoot upon landing, and then the knee valgus displacement is where the knee comes inward over the toe, kind of that in that second picture on the right there. It's obviously indicative of higher risk of like ACL injuries, just lower leg injuries in general. Is it valid and is it reliable? So it has been found to be pretty reliable as far as intra-rater, inter-rater, and intercession reliabilities. So that's really good. As far as a predictor for injury and validity, it's kind of subjective. Obviously, with some of them, people have different eyes. They see things a little bit differently, especially with the last question on the LESS test is just an overall impression: excellent, average, poor. That could look different for different people. So it's kind of question dependent. And when the LESS test was put against motion capture system, which is obviously going to have a much better eye for that, the validity differed based on the item in question, as some of the items are kind of hard to measure with the eye alone, as I stated. And then the predictive value for non-contact ACL injuries and other injuries can't really be ascertained at this point. Obviously, with non-contact injuries, it's really hard to predict what makes those happen. So not super surprising there. Some of the pros and cons: I think it's very specific to athletes, which is good. Athletes are going to have to jump and land and jump again, do repeatedly at different angles in practice and competition. So I think it's specific in that point. I do think it's very detailed as well. You're answering a lot of different questions, looking at a lot of different metrics, and you're taking video, you're not just looking at it with the naked eye, going back over, kind of seeing where those dysfunctions and improper movement patterns are. And then some of the cons, obviously, like I said earlier, it does leave some room for some subjectivity with just different raters. But in addition to that, it was found to be pretty reliable. So that's the good news. Then here are my references. Thank you for watching.